All right, time to check in with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19 and vaccines. Good morning. Thanks for joining us. Happy Friday.
Happy Friday, Bob.
Couple of stories going on, related stories. Moderna study suggesting 2 half doses offer a strong immune response. And this morning, we're learning that there's a couple of doctors actually published in the New England Journal of Health that the Pfizer vaccine, 1 dose is almost as good as 2. Do you think it's a good strategy to get more shots in arms with the single dose?
Yeah, I mean, so the single-dose Pfizer strategy is something that's been debated a long time. It's important to know those authors in the New England Journal really just reanalyzed the original clinical trial and said, if you could tease apart what happened between day 1 to day 14 after getting the first dose, which is where it wouldn't really work because it still needs time to kick in, and day 14 to the time you get the second dose, which is about a week later, that day 14 to day 21, you do see about 92% protection, which is fantastic, but it's really only based on looking at people for a week and seeing what it does. It really isn't something you can draw out to an entire population for weeks and months afterwards. But it is something to watch for, and the Israel experience is also showing that there is a good amount of protection after that first shot, at least temporarily. It still needs to be backed up by a second shot. The Moderna stuff is really interesting. So they took a look at antibody levels of people that got the vaccine at half the dose and full dose and saw they were pretty comparable across the board. It still isn't enough to say we should be administering it, but it is enough to say we should be doing a clinical trial for it, taking people and saying give them half Moderna dose versus full Moderna dose and seeing what happens. The implications are we double our supply overnight, and especially as we talk about giving this to the rest of the world, you know, it means more vaccines for everyone. So absolutely, that's a really, really good finding, and hopefully more study to come from it.
Yeah. How much the threat of the variants? First of all, the variants, and we're talking UK, we've got the South African, the Brazil variant. Are they equally transmissible in each country, or what are the factors behind their transmissibility?
Yeah, I mean, I think the UK one has been described as the most transmissible, and it has that mutation that helps either increase the viral load, which we're seeing in some studies, or help with the adherence of the virus to the respiratory tract when it gets to people. We do see the South African variant and Brazilian variant in their respective countries spreading. It's not clear whether or not that's because of transmissibility or it's the fact that it evades immunity. And so those patients that have had COVID-19 in the past could theoretically get it again. So it may be more transmissible in that sense. The really interesting and slightly scary thing about all of these is that we are seeing, even in the UK variant, independently, that some of the mutations that were in the Brazilian variant and the South African variant are showing up independently in the UK variant in Bristol, England. And that really does say that the virus, under the same pressures, seems to be getting the same mutations over and over again, which means this may be emerging in other parts of the world outside of Brazil, South Africa, and the United Kingdom.
Just a follow-up to last week, you made some headlines, and it was a big story here when you said we could have a cure for the common cold out of this thing. Further to that, Bill Gates is saying that some of the innovations through this pandemic could eradicate global diseases.
Yeah, I mean,
do you agree with that?
Yeah, mRNA vaccines are incredibly effective here, right? Like, we developed a vaccine in a year that is going to have profound population-based effects. The reality is many of the diseases that we struggle with outside of Canada, you know, in areas of the world that are low and middle income countries, you know, they don't get the headlines of COVID-19 because it hasn't been a global catastrophe. It hasn't, you know, really affected life in the Western world. But they cause an intense amount of suffering in other countries. And so using these platforms, using these technologies we developed for vaccines can easily be reverse engineered. And in fact, the vaccine we see, AstraZeneca and Johnson & Johnson, that adenovirus vaccine, was originally used in and will be used in the current Ebola crisis that's ongoing in West and Central Africa to actually help with reducing people getting Ebola who have been exposed in that sense. So some of this technology has already been used, and much of this is on the table for future diseases, both existing and future pandemics.
Well, that's a big silver lining. We always look for those during this thing. Dr. Zain Chagla, thanks again for joining us. Have a great weekend.